The patient experienced an elbow dislocation with a coronoid process fracture. Why is the elbow so unstable?
The elbow's instability is primarily due to the fracture of the coronoid process, which is the attachment point for the ulnar collateral ligament, UCL. Since the UCL is essential for medial elbow stability, the fracture has compromised this function.
What is the main goal of the treatment for this injury?
The main goal is to restore stability to the elbow by repairing the coronoid process fracture. This also involves reattaching the UCL to its original position on the coronoid process.
How do you repair the coronoid process fracture in this case?
The procedure involves a pull-out repair, where the fractured fragment of the coronoid process is secured using suture anchors. This ensures that the UCL is properly reattached and able to function, restoring stability to the medial aspect of the elbow.
Is it necessary to check for other injuries during the surgery?
Yes, it is crucial to assess the integrity of other structures, particularly the lateral collateral ligament complex and the radial head. Additional injuries to these structures could further contribute to elbow instability.
How do you decide using suture anchors for the repair?
The choice depends on the size of the coronoid fragment. For small fragments, suture anchors may be sufficient.
What is the post-operative rehabilitation plan?
Initially, the elbow is immobilized to protect the repair. After a few weeks, controlled early mobilization is introduced to prevent stiffness. However, any valgus stress on the elbow must be avoided during the early stages of rehabilitation to protect the UCL repair.
How long does it usually take for the patient to regain full elbow stability?
The timeline varies, but it generally takes a few months for full stability to be restored. Early rehabilitation focuses on range of motion, with strengthening exercises introduced later, usually after 6 to 8 weeks, depending on the patient's progress.